You're watching TV9 News and I'm 𝗪𝗺𝗪. As India is witnessing the second wave of COVID-19, post-recovery complications have stirred a cause of worry for health officials. Health officials are alarmed at cases of mucormycosis or black fungus seen in recovered COVID-19 patients. Now, health officials in Gujarat, Surat have recently reported at least 8 people who have lost their eyesight due to mucormycosis. The city in the last 15 days has reported at least 40 cases of black fungus, including the recent 8 who lost their eyesight. The cases have been reported from other parts of the country as well, including certain parts of Maharashtra. What is black fungus or mucormycosis? The US Centers for Disease Control and Prevention, the CDC, has defined mucormycosis as serious but a rare fungal infection caused by 𝗪𝗵𝗁. Here is Dr. Shantanu Tandon, Senior ENT Surgeon at Bengaluru's Sakra World Hospital, explaining mucormycosis.
So, mucormycosis is a fungal disease. It's not a very common one, or it used to not be a very common one, but it can be very, very severe. This usually affects the nose, the sinuses, the paranasal sinuses, and sometimes it can spread to the eye and the brain. Now, how this works and why is it called a black fungus? Well, it basically causes a blockage of all the blood vessels, small and large, which supply the areas in and around this region of the face. When there is a blockage of these blood vessels, it causes the blood flow to decrease, which causes a process called necrosis due to infarction, and that makes the whole area turn black.
Now, what are the symptoms? So you have recovered from COVID-19, but how do you know that you have mucormycosis? Here is Dr. Tandon explaining in detail the symptoms one has to watch out for.
So like we mentioned, although blackening of the face, the area over the nose, etc. can be seen in mucormycosis, that is by far not the first. There are a lot of early signs which one should be careful about when they're dealing with a patient with decreased immunity. Patients with mucormycosis can start off by complaining of headaches. They can complain of facial pain. Over a period of time, they can develop swelling over the face, over the eyelids. Sometimes the eyeball can actually start getting pushed outwards, and the patients may start developing a blurring of vision and decreased visibility. They also have sometimes spread to the brain, which can cause much more severe neurological complications. But patients with diabetes, you should always look for a little bit of bleeding or mucus coming from the nose, especially if it's only on one side, which could be a very early sign of mucormycosis.
Who are the most vulnerable? This is very important. The cases of black fungus have been identified in patients who have recovered from COVID-19. Now, according to the US CDC, people with diabetes, cancer, and who have had an organ transplant or stem cell transplant might be more vulnerable to a fungal infection. So, Dr. Tandon, according to you, who is more vulnerable?
Mucormycosis used to be an uncommon condition, not as uncommon as it is these days. We're finding more and more cases of people with decreased immunity who are more susceptible to this kind of a problem. Patients who frequently get mucormycosis are uncontrolled diabetics, patients who have severe kidney disease and are on dialysis, and people whose immunity is compromised due to any other medications which are going on. Unfortunately, these are the exact type of patients who are also more prone to developing other medical problems such as COVID, and when we add other medications to it, they fall prey to this problem. Now, there is a lot of talk about the use of steroids, specific medications called tocilizumab and various other such medications. And the question which sometimes arises is this more harmful and can they cause problems like this? But the short answer is they do not directly cause problems of mucormycosis. But what they do cause is a certain amount of immunosuppression. That is, these medicines are required to decrease the inflammation but also can decrease the immunity. And if the patients are already unstable, either due to decreased control of blood sugar or various other problems, then they can be more prone to developing mucormycosis. Now, that does not mean that we stop these medications, because unfortunately patients are dying of COVID and these can be life-saving drugs. So there is a very specific balance that we need to look for to prevent any side effects, but at the same time prevent the effects of COVID.
Is mucormycosis treatable? The US CDC has noted that although the condition is serious, it can be treated using prescription antifungal medicine. We urge you to not take any over-the-counter antifungal medicine, and it is important to consult a doctor before you take any drugs. Dr. Tandon, is the condition treatable and what can be the treatments?
Now, mucormycosis is primarily treated with medications, but not just any medication. There are specific antifungal drugs which are used for invasive fungal disease such as mucormycosis. Medicines such as amphotericin B, voriconazole, posaconazole, there are various injections and tablet formulations, and they have to be used for long periods of time. Unfortunately, these are also very strong chemicals and they can have side effects. So not only do we need to start medications, but we also need to monitor them well, make sure that there is no fluctuation of their immunity and secondary infections, and make sure that we are able to decrease the duration of medicines. And how we do that is by doing certain types of surgeries to debride and remove the fungal load and therefore allow the medicines to work.
What has the government said? Now, Dr. 𝗵𝗵𝘁, who is a member of the Niti Aayog Health Think Tank, noted that the fungal infection is being found in COVID-19 patients and largely in cases of those who are diabetic. But as of now, there is no big outbreak. The doctor also stressed that the situation is being monitored and treatment is available. Now, Dr. Paul also stressed the proper usage of steroids in COVID-19 patients. Dr. Paul said, and I quote, "Whoever has diabetes needs to control the sugar level always. We are promoting the administration of steroids, but they should not be given at the onset of COVID-19. Steroids should not be given unnecessarily. They can be given after the 6th day and should be given for a stipulated period of time and not for long," quote unquote. According to Dr. Paul, it is also important to maintain hygiene among COVID-19 patients, and it is important to take proper post-COVID care in recovered patients. If you like this video, do give this video a big thumbs up and don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.